Health Minister has just briefed the media on South Africa's preparedness regarding China's coronavirus. Our reporter Chriselda Lewis is there. Very good morning to you, Chriselda. What did the minister have to say?
Well, Desiree, I think it was important to clarify and basically to deal with some of the panic that may be going around the country. The Health Minister, Dr. Zweli Mkhize, basically saying that there are no reported cases of the coronavirus in South Africa at this stage. But we're hearing, of course, from the World Health Organization. The panic, of course, Desiree, is as a result of what the World Health Organization also briefed us about here today, saying that basically there are, reported cases of infections in 14 countries outside of China, where all of this originated from Wuhan, in fact. So, it was quite ideal for the Minister of Health to come and, assure South Africans that they're doing everything possible to ensure that there is a state of readiness and all the mechanisms have been put in place in the event that this does become a threat to South Africa. You would know, of course, that there has been a reported case in Ethiopia. We also understand that South Africa has been asked to assist in terms of looking at some of the samples and testing of this reported case in Ethiopia. So South Africa has also been asked to come on board to assist in many aspects, including testing as well. What we also do know, Desiree, is that there are currently 35 South Africans that are in Wuhan, and you would know that is the epicenter or the actual place where this virus had first been detected. What South Africa is saying currently is that they've been in contact with the Chinese authorities and they don't see any need for evacuation at this point, and that they will continue to monitor the situation there. You'd know that many South Africans are obviously in that country for work, but in the particular area where this virus is said to have been detected first in Wuhan, there are 35 South Africans who are currently there at this point. The Department of International Relations, we understand, is in constant contact with those individuals, and if there's a need in future, which the minister says that they don't see at this point, to evacuate those South Africans, they would need to evaluate at a later stage. I asked about issues pertaining to the ports of entry into South Africa. You would know, of course, that there are quite a number of flights that do come from China to the biggest airport here, of course, OR Tambo International Airport. What they're saying is that they've intensified the screening process. So you would know that scanner, Desiree, that is often put towards your forehead to check your temperature. What the minister is saying currently is that they've intensified that operation, and they are confident at this stage that they will be able to deal with the possible threat of the coronavirus if it does come towards the shores of South Africa. A national operations centre has also been set up here at the National Institute for Communicable Diseases. We just took a tour of that just a short while ago. Apologies, Desiree, I could not cross to you from there, as we had to come back to this place where the press conference was held due to our quite short cables here. But anyway, that operations centre, we understand, is on high alert according to the officials here. They're waiting, of course, to hear from anyone possibly who may want to report a suspected case. South Africa says it is ready at this stage. Let's chat now, to Professor Cheryl Cohen, who is the head of the Centre for Respiratory Diseases. Prof, thank you very much indeed for your time. I mean, at this stage, if we look at South Africa's state of preparedness, how would you measure it against what we're seeing as a widespread, virus that is now affecting 14 countries outside of China?
So I think it's important to note that South Africa is prepared, and as Minister mentioned in the briefing that has just been had, we're really at the highest level of alert that we can be at, unless we actually detect a case or the World Health Organization were to declare a public health emergency of international concern. So South Africa is doing a large number of different activities. You already mentioned in your report that there are already strengthened activities at the ports of entry, screening incoming passengers with fever, focusing really on those more high-risk flights from China. So there's a lot happening at the ports. There's also a lot that's been done in the clinical space, really reaching out very, very widely to healthcare workers of all levels, from doctors down to pharmacists, to make sure that healthcare workers know about this virus, they know about the signs and symptoms, and they know which patients they should suspect or consider of having the infection, and to be sure that healthcare workers know what to do should they have a suspected case. And if they have a suspected case, we've really put out guidelines that healthcare workers should firstly isolate the case to prevent any potential onward spread, that they should manage the case and they know how to treat the patient, that they don't deteriorate clinically, and also that they should know how to take the samples, and there are systems to rapidly transport those samples to our laboratories here at the NICD.
Yeah. We spoke about a suspected case on the African continent in Ethiopia. We know that South Africa has been called on to assist with, for example, testing. When are you expecting those samples to arrive in South Africa, to give an indication of if indeed that is the case?
So our laboratory here at the NICD of the NHLS has been asked by the World Health Organization and the Africa Centers for Disease Control and Prevention to act as a reference laboratory for the African continent. And what this means is that we are offering two things. Firstly, assistance with the diagnosis of suspected cases from other African countries, and then also really helping to facilitate for a number of different African countries to get the assay and the test up and running. And so we've actually, a number of countries have reached out to us with regard to assistance, and this includes Ethiopia, and it's my understanding that those samples are on the way.
Which other countries have appealed for assistance?
I don't have a comprehensive list at this time. Those appeals are really coming in all the time.
I heard the Minister mention that part of all this preparation is to identify hospitals as well that would be able to deal with this in the event that it does become a national threat. Are you satisfied with the hospitals that have been identified? I'm sure you heard me a bit earlier on ask the Minister that facilities like Tembisa Hospital, for example, are highly understaffed, and he agrees with me on that statement. So South Africa's preparedness in terms of identifying, monitoring, and then actually dealing with the potential case, hospitals would certainly would need to be properly equipped and with the correct staffing numbers as well.
So as you mentioned, and Minister mentioned in the briefing, hospitals have been identified. What was very helpful, I think, in responding to this virus is that, in fact, there was a comprehensive preparedness plan already in place in response to the Ebola outbreak in West Africa. And so really the designation of dedicated facilities built on that infrastructure that had already been put in place for that outbreak. As Minister mentioned, I think it's important to distinguish between the facilities needed to contain really a small number of infectious cases and isolate them, as compared to the more general functioning of a hospital in terms of the other wards. So I think there's really been a lot of effort and a lot of building of infrastructure and putting in of capacity in the designated hospitals by the Department of Health. And this, in fact, has been ongoing for quite some time as part of our general preparedness activities for other outbreaks, which I think really has helped us to be already on the move before this happened.
Yeah. Just lastly, Professor Cohen, there have been reports that, the virus itself is not really picked up at the airport. I know in 2 cases in the United States of America, it was only after the patients themselves felt sick. They had not yet been detected. Isn't that of concern? Because while you have the ports of entry covered, the virus itself, it doesn't seem to be picked up by possibly this device. It's only when you start feeling ill that those 2 incidents in the United States, people started taking themselves to hospital.
So that's a very important point that you raise, and I think it's recognized for a number of infectious diseases, not in fact only this virus, that screening at the ports of entry is not 100% secure. So it's really just one part of our preparedness, and we do know that a number of countries have picked up cases at their ports. But we also are fully aware that patients may be infected with the virus and not showing any symptoms at the time of entry through the ports, or patients could could take medications to suppress their fever. And that's why we've really made sure, and certainly the media is assisting in this, that the message is very, very widely available to all levels of healthcare practitioners, that they also know about this virus, and they know that when patients present with symptoms that are compatible, that they should be alert, that they should ask the relevant questions, and then that they should rapidly act to help us diagnose a case. So I think it's important to note that the ports will never be the total protection. What's really important is to make sure that healthcare workers are aware and can rapidly diagnose and respond to cases.
Professor Cheryl Cohen is the head of the Centre for Respiratory Diseases here at the National Institute for Communicable Diseases, saying, of course, I think one of the crucial aspects there, Desiree, was that in our reporting of, the spread of this coronavirus, there'd been great concern about, the virus not being detected at ports of entry and only patients, basically letting authorities know that they're not feeling well way after they have gone through various airports. So, Professor Cohen saying that, that is not the last end of it, while that is a measure that has been put in place in terms of the screening at airports, one cannot really say that is 100%. People would take medication to suppress what they would feel in terms of a fever. You might not be able to pick that up, but, all the measures that are being put in place at this stage is to ensure that South Africa is ready. They're calling out to anyone and asking the media as well to assist in this regard. If anyone may suspect that they may be feeling, somehow in terms of or feeling ill with the symptoms that we've really widely circulated in terms of fever, difficulty in terms of breathing, certainly report that and get yourself checked, and then we'll hear obviously from doctors on whether you need to be referred, of course, to some of the specialists here at the National Institute for Communicable Diseases. But let's take a listen to a clip from what Dr. Zweli Mkhize had earlier said, saying basically that South Africa has no reported cases of the coronavirus at this stage. Let's take a listen.
On the 27th of January, we published travel advice based on WHO recommendations. These take into consideration all factors which determine the level of threat to a particular territory. I may as well pause here to say that we are also on the lookout with detecting some fake news that seem to be distributed in social media as notices coming from the Minister of Health, which is untrue. And so we will be doing our own briefings regularly so that you know the authenticity of the information that you're getting. The guidelines have not recommended any restrictions on travel and trade, but it is recommended that non-essential travel to Wuhan city in Hubei province should be avoided or postponed. Prospective travelers can monitor the situation and plan their travel accordingly. Our understanding is that currently Wuhan city is essentially quarantined and 5 million citizens have been evacuated. Chinese authorities have closed all public transport entering and leaving Wuhan and other areas in Hubei province. South Africa has responded rapidly to ensure that the coronavirus does not become a national threat. As a department, it is standard procedure to monitor emergent outbreaks, and we are currently tracking a plethora of pathogens, including those viruses of pandemic potential like H5N1. We also then wish to reassure that coronavirus is no exception. We're working very carefully to ensure that we track everything around this virus.
Well, South Africa, they're saying through the Health Minister, Dr. Zweli Mkhize, that there's no need to panic at this stage. They've put in all the mechanisms in place to ensure that they're able to monitor and detect, the possible threat of the coronavirus. And on the issue of travel restrictions, one of the questions, Desiree, that I put to the ministers, the Home Affairs Minister as well, Dr. Aaron Motsoaledi was also in attendance here, on the issue of, possible limiting some of the flights flights coming in from Asia. South Africa says there's no need for that at this stage. But obviously, Desiree, they would need to evaluate the situation as time goes by, as the death toll rises, as it spreads seemingly to more countries, and including, of course, to what is a suspected case from Ethiopia, of course, which South Africa will be testing at a laboratory here in Johannesburg. Certainly, South Africa is not going to stick to one approach. It would need to re-evaluate its stance as the virus itself spreads, and as, of course, there continues to be great concern around the world.
Chriselda Lewis, thank you so much for that update coming to us from the National Institute of Communicable Diseases, where that update was given in the morning by the Minister of Health, Dr. Zweli Mkhize. Now, as part of our poll this morning, we're asking you, as our viewers, the Minister announced that there are no travel restrictions to China, although the country is on high alert and watching developments in that country. Are you concerned about the spread of coronavirus? And that's what we're asking you. Send us your thoughts at the agenda _SABC. We'll take a look at those thoughts later on the show.